Ladies and gentlemen, welcome to our training program today. Updates on aseptic services, total parenteral nutrition, and cytotoxic drug reconstitution by production of pharmacy unit. Today, our presenter is Sister Nohaina Abu Hassan Syari, our pharmacist from Production Pharmacy Unit, Sultan Ahmad Shah Medical Center. Without further ado, I would like to invite Sister Nohaina. Tafadhal mashkura.
Sorry kejap ya. Okay, so boleh dapat slide kan? Bismillahirrahmanirrahim. Okay. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh and very good morning to everyone. So I was given an opportunity to give a bit training or updates regarding aseptic services, especially on total parenteral nutrition and cytotoxic drug reconstitution. So I will begin. So our topics for today are mainly about parenteral nutrition or PN, cytotoxic drug reconstitution or CDR, and also sterile preparation and sterile compounding. So first, we will look about parenteral nutrition. I'm sure there must be some people yang tak pernah dengar, never heard of parenteral nutrition, and also some others yang very well versed or pernah dengar banyak kali about parenteral nutrition. So what is parenteral nutrition? Parenteral nutrition is intravenous administration of nutrition, which means nutrition that is given through intravenously, which may include protein, carbohydrate, and fat, which are micronutrients, and also minerals, electrolytes, vitamins, and other trace elements, which is also called as micronutrients for patients who cannot eat or absorb enough food through tube feeding formula or by mouth. Which means if the patient cannot get enough nutrition through mouth or enteral feeding, then this is where parenteral nutrition comes. Okay, so actually the common term for PN previously was TPN. People usually call it just TPN, but the correct term is PN because parenteral nutrition itself can be divided into total parenteral nutrition or supplemental parenteral nutrition. Total parenteral nutrition or TPN is actually where the patient gets the nutrition solely from parenteral or solely from intravenous route lah. But for supplemental, which means that the patient do get some nutrition from oral or enteral route, and it is supplemented by the parenteral nutrition because the nutrition that they get from oral or enteral is insufficient. Okay, so other than that, PN can be given through central or peripheral route, or we call central line or peripheral line. Okay, central line usually when we give through CBL or PICC, and it's usually for long term lah. Peripheral usually for short term because it's not safe to give through peripheral for a long time lah, usually less than 2 weeks or 2 to 3 weeks, so okay lah to use peripheral route. And then the difference between central and peripheral ni, because when the PN has higher calorie, it will have higher osmolarity. So when we have a higher osmolarity, we cannot give it to peripheral route lah. Okay, and then parenteral nutrition, there's a difference between adults and neonates. So I will introduce one by one. Okay, first we look at parenteral nutrition for adults. Okay, like I said in the definition, the indication for parenteral nutrition is for patients who cannot get nutrition through oral or enteral, because the best option is actually oral and enteral, because when we give through parenteral or intravenous, it's open to either possibility of complication lah, for example infection. So but if the patient have For example, an obstruction in the guide or GIT, or the GIT cannot absorb well, or it is unsafe for the patient to get nutrition through oral or enteral, then the patient is indicated for parenteral nutrition lah. Or when the patient, like I said before, the patient does get nutrition from oral or enteral, but it's insufficient to maintain a good nutrition status for the patient, then we can give parenteral nutrition for patient lah. So, but first we need to remember parenteral nutrition is not the first option lah. We should try, if possible, or if it is safe, we give nutrition through oral or enteral first lah. Okay, and for adults, the parenteral nutrition is the commercial, yang ada commercial is the ready to use lah, or we call it as all-in-one. All-in-one, why? Because we have in the bag, macam dalam gambar, in the picture, we can see that it has dextrose here, or apa tu, carbohydrate, and amino acid, protein, and also fat, lipid here lah. All the micronutrients are in there, and also we have electrolytes in the bag. So dah complete lah in the bag. Okay, and then meaning pharmacy no need to compound lah, but well, as stated, there's also some small components that is not included in the bag. Okay, and as mentioned previously, there is central bags and also peripheral bags. I will show the list of available bags in SASMED lah. The difference is in the amount of calorie, the volume, the osmolarity in the bag, sorry. Okay, and then parenteral nutrition for adults, it can be given continuously for 24 hours, meaning after that, in 24 hours, when the bag is completed, we immediately start with a new bag continuously lah. Or it is also can be given cyclical, which means it can be given for example 20 hours or 16 hours, and then after that there's a period of rest. Kalau 16 hours ada 8 hours rest, kalau 20 hours ada 4 hours rest for the patient lah. Cyclical ni usually for patient yang need to undergo physiotherapy, kena ambulate, and for the patient convenience tu kita tak pasang PN lah time dia buat physio. Or for patient that has liver dia tak okay, then we give the cyclical to give a rest for the liver lah. Kan macam kita tahu, when we give nutrition, the liver need to metabolize kerja lah. Okay, but the shortest period for cyclical is actually 14 hours, but the yang common is 16 hours lah kita guna. Okay, for additive or electrolytes, like I said before, in the bag, in the all-in-one bag, we have dextrose, amino acid, and lipid, but we don't have the small the micronutrients like vitamins, trace element, and also even though we already have electrolytes such as sodium, potassium, calcium in the bag, but it is also possible to add in more electrolytes if indicated lah. For example, if patient have persistent hyponatremia or hypokalemia, but the amount tu we should look lah, yang berapa yang the patient require and berapa yang bag tu boleh tampung for the stability. Because as we know, in this PN bag, there's a lot of components, so the punya stability tu kita kena jaga, is very ni lah, fragile lah. Tak boleh main campur je semua. Kita kena tengok dulu. Okay. Next, okay, we show the available bags in SASMED. There are 5 bags for adults. The main brand that we keep is Smofcabiven. Smofcabiven ni this difference with other brand is mostly dekat lipid lah, and also the calorie and the volume. Okay. And I also show here the administration route. So for central bag, we can use only central route, tak boleh pakai peri. For peri bag, we can use both peri or central line lah. Okay, we have the 1100 in 100 ml, the 1600 kilocal in 1500 ml, peri only one, 800 kilocal in 1200 ml, and then the EF is the electrolyte free, 550 kilocal in 500 ml, mostly for IDP and intradialysis, parenteral nutrition lah, patient undergo hemodialysis, or patient that has dia punya electrolyte sangat tak okay, then nak give the electrolyte free punya bag, then it could be used, this bag can be used lah. But this one also central line only. And lastly, we have NutriFlex Omega Special from B Brown, 740 kilocal in 625 ml. This one is yang quite most concentrated lah. Okay. As we can see, the peri bag, the calorie dia tak banyak, but the volume is tinggi, so that's why the osmolarity is not very high, which means that it is suitable for peripheral line lah. Okay, next is additives. Macam saya kata tadi, micronutrients or small macam vitamins, trace element is not included in the bag because when it is added, the stability akan jadi pending. When vitamins and trace element is added, the stability is only for 7 days. Because it is mixed together, and alright. So the brand that we have here, or the one that we use in Susmac, is for vitamins. We use Cernabate. It has both water soluble and liquid soluble vitamins, A, B, C, D, E lah, except for vitamin K. It is not included in the Cernabate lah. Okay, this one for adult patients only. In the dose is 5 ml. Okay, 5 ml is in the form of powder. So we need to dilute with 5 ml of water for injection lah. And then Advent. Advent is trace element which includes selenium, zinc, manganese, iodide, semua tu. And this one is also for adult patients lah mostly. And the dose is 10 ml. For all adults 10 ml. Okay, and the practice here in Susmac for the additive ni, because we need to add the manually lah kan. For ICU patients, we give it every other day dosing. Okay, and for surgery or other wards, we will compound, we will add daily lah, except for weekend and public holiday. Okay, then another one is also a component that is not included in the all-in-one bag, but it can be added later lah dalam bag tu. It's called dipeptivan or glutamine lah. Dipeptivan 100 ml is actually a 20% concentrate of dipeptyl alanine glutamine, which means ada dua peptide lah, dua jenis peptide, alanine and glutamine. Okay, and that in 100 ml it contains 13.56 gram glutamine. Okay. What is glutamine? Glutamine is amino acid. It is actually an essential amino acid, but when the patient is critically ill or under stress, they become depleted lah. It will be used up by the body, so it will be conditionally essential amino acid. Okay, that's why sometimes we must add for the patient lah untuk help the fight infection to heal. Okay, kenapa? Why it is not included in the PN solution yang ready-made tu? Because glutamine itself is not stable, ataupun chemical properties dia tak stable lah. That's why it is need to be formulated as dipeptide and then separately. If it's included in the PN bag, it will not be stable lah. Macam maybe sehari dua je dah kena discard ke macam tu. Okay. So as I said before, it's actually an amino acid. So it is the indication is this sebenarnya memang a part of clinical nutrition regimen lah. Okay, especially for patient yang in hypercatabolic or hypermetabolic states. Macam like amino acid tu when patient is under stress or critically ill, so ada possibility glutamine is depleted, so kita kena tambah. That's the indication lah. And usually the dose is 1.5 to 2.5 ml per kg per day. We usually take 2.5 ml per kg per day lah, which dalam dia ada 0.35 gram glutamine per kg per day. And but this one, dipeptivan, we didn't add it routinely like unlike vitamin and trace element. We only add this upon request by the prescriber or specialist. Okay, because it is actually costly lah. One bottle 100 ml costs about 170 ringgit. Okay, so yang mana patient indicated tu baru kita bagilah. Okay, so now we'll just show briefly how to what are the steps when the prescriber nak prescribe adult PN lah. Okay, first prescriber need for patient yang newly started and adult patient lah. The prescriber need to fill in the nutritional screening form that can be retrieve or access in the pesakit dekat template bawah tab pharmacy. Okay, ada nutritional screening form. You must fill in all this information. Okay. And then this is the important part lah. Kena buat initial screening dulu. Tengok patient ni BMI less than 18 or more than 30, memang ada loss of weight ke, loss of appetite, memang tak akan dapat nutritional intake yang mencukupi in more than 5 days ke. Okay. If either one yes, baru boleh proceed to the final screening lah. Screening ni pun kena letak skor yang betul lah, because banyak yang kami terima skor ni sama ada tak betul ataupun tak diisi. Okay, why we need this NRS screening form is because we need to screen whether patient ni betul-betul memerlukan intervention lah, clinical intervention. Is it memang indicated for PN or not? Okay. So just need the prescriber to fill in correctly lah and properly. Maksudnya sebahagian yang ni isi, yang ni pun isi. If ada yang tak clear, nanti pharmacy akan contact doktor lah. Tapi if dah clear kat sini, then there's no need for that lah. The prescriber need to fill in NRS, then baru boleh prescribe PN in pesakit. Okay, so to prescribe PN, macam biasa, go to e-prescribing. And there's a button here at TPN. Okay, so the important part here when prescribe kategori of course akan jadi adult, and regime tu kena pilih yang betul lah, because sometimes the default kalau if tak pilih betul dia akan jadi lari lah, pergi ke EF lah ataupun not the correct bag. Duration ni pun need to put in kalau if for continuous 24 hours, if cyclical maybe 16 hours or 20 hours lah. And route ni pun penting because like I said before, if the bag is central bag, then kena ambil route central lah. Kalau peri bag, then it could be central or peripheral. Flow rate ni actually it's must be filled in, but it's also auto calculate. If there is yang mana doktor kira sendiri, contoh nak guna bag 1600 kilocal tapi bagi 1400 je, then you can key in the flow rate yang dah kira lah. But sometimes in air pesakit dia akan terjadi auto calculate balik, but don't worry, pharmacy akan tengok balik lah, pharmacy akan tengok balik and screen balik. But it will be helpful if the prescriber tulis dalam notes ke yang nak bagi how many kilocal lah. Okay, then after that kena masukkan the additive, trace element and vitamin lah. Kat ingredient ni you can choose from the drop down trace element, and the volume like I said before 10 ml for adults. Another one is vitamin or synervit. Okay, we can choose vitamin and then put in 5 ml lah. The volume is not 10 ml, there is 5 ml. Then another one is glutamine or rapactivin. Dekat ingredient ni it will come out as glutamine lah. And then the correct dose here is in ml. So like I mentioned previously, the dose is 1.5 to 2.5 ml per kg per day, or the common dose is 2.5 ml lah. Okay, we are to calculate here according to the weight, but usually if the total volume is around like 130, 120, we will round it down to 100 ml lah. Kita tak nak membazir because like I said before, the rapactivin ni is quite costly lah. So 130, 120 ni kita akan bagi satu botol saja, or 100 ml. Okay, so before we proceed to neonates, just a few reminder that I want to share to semualah yang terlibat dengan PN ni. First, I need cooperation from prescriber to prescribe in air pesakit before 11 AM. Okay, because in our unit we have schedule. Pagi memang kita akan masuk clean room and also untuk prepare to compound all lah macam TPN, CDR semua. Okay. Kalau petang tu dah we have other works to do lah. So memang pagi untuk memang jadual untuk masuk dalam clean room to prepare the parental nutrition, CDR semualah. And if ada patient newly started after 11 AM ataupun during weekend or public holiday, please call PPU pharmacist or PPU di our unit lah to inform us, because pharmacist we will do the screening actually until 11 AM or so lah, atau 12 PM macam tu. But if tiba-tiba nak start baru pukul 2 ke pukul 3 ke, kami is there's a possibility kami tak tahu pun, tak perasan pun kan. So kena call and inform the patient nak start baru. And during weekend pun of course lah, sebab weekend yang bekerja dekat inpatient pharmacist je yang ada on call, so need to call TPN pharmacist yang on call lah, then we can prepare lah. Okay, that's also actually kalau weekend and public holiday pun our working time pun macam working hour lah 8 AM to 5 PM macam tu. Okay, and then I would like to mention lah juga yang PN ni is not life saving or urgent. There's no stat lah in TPN, because as in the Expiry guideline, when indicated, maksudnya when the patient cannot get nutrition from oral or enteral, then parenteral nutrition can be started within 24 to 48 hours lah if the patient is stable. Okay. Sebab sometimes ada yang doktor yang baru nak start dia pukul 5 or very close to our nak balik lah kan. So it's actually can be given tomorrow lah. Okay. So another one is for the prescriber or staff nurse yang akan handle PN tu, please read the label or any additional instruction carefully, especially on the flow rate and duration of infusion lah, because sometimes ada perubahan from day to day kan, in the flow rate sometimes nak increase or nak reduce, duration of infusion pun kadang-kadang berubah. Sometimes patient tu before this 24 hours and tiba-tiba nak tukar pada cyclical. And then please return and use PN bag immediately to pharmacy, because especially yang dah mix lah. Kalau yang tak mix lagi tu pun kena pulangkan segera, sebab kita boleh guna untuk patient lain. And because I mentioned before, stability after mix only 7 days lah. If ada patient dah tak pakai ke or LO ke, then we can use for other patient lah within that 7 days if dah mix. Okay. And then we go to parental nutrition for neonates or pediatrics lah, but actually yang this one is more to neonates lah. Okay, for parental nutrition for neonates, the indication is for premature infants or very low birth weight, infant yang ada, neonates yang ada very low birth weight, and also for babies yang not on significant enteral feeds for 3 to 5 days or more than that, and also a patient with NEC. Okay, patient macam ni lah kita yang bisa indicated for TPN. But for neonates, there's no ready to use or commercial preparation or all-in-one, so we need to compound manually lah, macam dalam gambar ni kita masukkan semua dalam ni. Okay, alright. So right now we have standard formula or standard regime, and also we still do individualized lah if or bespoke if necessary, if indicated. Okay, biasa yang individualized ni for baby yang tak stabil, maksudnya tak boleh pakai yang mana yang standard lah, we need special adjustment kan. Okay, for standard formulation we have solution A, B, C and standard lipid. So I will show the difference. Okay, ni dia lah, the difference in content semua. So for starter is usually it is the smallest bag untuk baby yang in the first 24 to 48 hours of life lah. Dia ada sikit je protein or amino acid with no potassium and no trace element and vitamin lah. Okay. And then we have solution A, B and C. Apa beza, what is the difference between A, B and C ni? The difference is in the dextrose concentration lah. Kalau A 7.5%, B 10%, C 12.5%. Okay. As you can see here ada A1, A2 kan, ada B1, B2. Apa beza A1, A2 ni? A1 kalau the difference is A2 is for the high sodium lah. Saya ada highlight sini 12 millimole. But sometimes ada baby yang memang sodium dia tend to be low. Betul. Yang lain semua sama je. Kalau B1, B2 ni dia beza dia 10% kan, and also the difference in the sodium lah. Solution C ni is for bigger baby because we can see here dia punya volume lagi besar lah, ni yang paling besar lah. Okay, so the prescriber need to choose according to baby's punya requirement lah, mana dia nak bagi dextrose tinggi sikit ke, rendah sikit ke, sodium yang biasa atau yang tinggi ke. Okay, kalau baby yang stable ni memang okey lah untuk pakai standard regimes. Alright. Okay, so because dalam standard regime yang back tadi tu, dia tak ada lipid and also fat soluble vitamin are given separately. So this is the standard lipid lah kita prepare. So according to berapa gram yang nak dibagi, kita akan bagi different volume lah, either 10 ml, 30 ml or 50 ml. Okay, so here's how to prescribe PN for neonates lah. Kalau doktor dekat ACN, ACU biasanya dah biasa, but I just want to show balik lah. Untuk for individualized or bespoke TPN bag for neonates, okay, macam biasa dekat e-prescribing at TPN, but the important part here is when choosing the category, kena ambil pediatric. Untuk yang bespoke lah, ambil pediatric, and then the regime akan keluar no regime. Meaning kita tak ada regime yang fix lah, kita akan buat sendiri regime tu kan. Okay, and then yang lain mesti macam biasa, diagnosis, weight, make sure betul. Root, usually kalau 10% tu preferral okay lagi lah, unless the amino acid amount is tinggi kan. If 12.5% above, then memang of course central root lah. Flow rate ni pun must be calculated correctly according to the total fluid lah yang nak bagi to the baby for PN yang allocated for PN. Okay, so bila dah safe akan keluar actually kosong lah. So for individualized, the prescriber need to add one by one the component. For example, add amino acid dulu, and then dextrose, and then sodium, potassium, semua lah sampai habis, sampai vitamin, trace element, lipid semua. Okay, but after that when screening, pharmacist pun akan tengok jugalah. We will see is it apa yang doktor prescribe tu sesuai dengan patient tu punya, contohnya electrolyte profile semua kan. And also we will check the stability lah, because sometimes if the volume is too small tapi nak letak banyak benda, contoh amino acid nak tinggi, dextrose nak tinggi, that is not possible lah, and we will discuss with doctor lah accordingly. Okay, for standard regime, okay, standard regime, the difference is dekat kategori ni kena pilih NICU. When you choose NICU, then the regime akan keluar semua ni lah, semua standard solution yang saya tunjuk tadi. Then choose correctly yang mana nak pakai, A1 ke, B1 ke, C ke. Okay, so bila dah choose tu macam biasa juga, put in the weight, the root. Saya dah tunjuk tadi kalau usually A sampai B ni it can be given to peripheral or central lah. C ni of course kena central because the dextrose is concentration is 12.5.
Okay. Ada makanan tu.
Flow rate. Boleh mute ke? Okay, thank you. Okay, so sama juga dekat flow rate dia kena make sure masukkan yang betul lah according to total fluid. Okay. If not, pharmacist will also confirm back with doctor lah. Okay, flow rate. And then bila dah save, dia akan keluar terus apa macam ni kan, according to the amount will be according to which solution yang you choose lah. But for the lipid kena tambah lain pula, kena tambah after that. Okay, so just choose from the ingredient lipid and then put in how many gram per kg yang nak bagi, 1 gram or 2 gram. Okay, and then you kena put in the duration lah lepas lipid ni. Another one is fat soluble vitamin or vitalipid lah, kena masukkan juga. Okay, and then boleh proceed lah. Okay, and then some reminders for PN unit ni lah, bersama juga. Please prescribe minum air pesakit before 11 AM because kita nak prepare atau berapa banyak kita nak buat, nak masuk dalam nak prepare lah. Because kita tak nak, kalau lambat nanti siap pun lambat lah. We try to finish before like memang akan dapat within working hour, but lagi lambat prescribe lagi lambat akan dapat lah. Okay, lepas tu starter bag and standard lipid yang 10 ml are available as flow stock at SCN or NICU. So bila ada nak pakai, contoh for example anytime lah, weekend ke or after office hours je, after office hour ke boleh pakai. But after that dia minta doktor prescriber please prescribe or order dalam air pesakit lah, nanti for our record, okay, and for us to charge apa semua lah. Okay, and then it's also important to check the expiry date of the starter bag and lipid yang ada dekat ward lah sebelum pakai, sebab starter bag and lipid ni, starter bag dia punya expiry is or the stability dia 21 days only, and lipid 28 days only lah. Dia tak lama, dia tak ni sangat lah. So kena regularly check ataupun sebelum nak bagi tu check dulu. And if dah dekat or dah nak expired, then can call our unit lah to see if can exchange ke or macam mana. Alright, and then sama juga read the label and additional instruction if any carefully, and then please return unused PN bags or lipid immediately to pharmacy, sebab yang
والصلاة والسلام على أشرف الأنبياء والمرسلين وعلى آله وصحبه أجمعين. اللهم إنا نسألك علما نافعا ورزقا طيبا وعملا متقبلا. يا الله kami mohon kepadamu agar dikurniakan ilmu yang bermanfaat, rezeki yang baik dan amalan yang diterima. Allahumma afina fi badanina, Allahumma afina fi sam'ina, Allahumma afina fi basarina, la ilaha illa anta. Ya Allah, kurniakanlah kesihatan kepada tubuh badan kami, kesihatan kepada pendengaran kami, dan kesihatan kepada penglihatan kami. Sesungguhnya tiada Tuhan yang berhak disembah melainkan Engkau. Additives ba'sa rabban nas, ishfi wa anta syafi, la shifaa illa shifauka, shifaan la yughadiru saqaman. Hilangkanlah penyakit wahai Tuhan sekalian manusia. Sembuhkanlah wahai yang maha menyembuhkan. Tidak ada yang dapat menyembuhkan melainkan kesembuhan daripadamu, yaitu kesembuhan yang tidak meninggalkan penyakit. Allahumma inna na'udzubika min jahdil bala wa dara'is syaqa wa su'il qada wa syamatatil a'la. Ya Allah, sesungguhnya kami berlindung kepadamu daripada ujian yang berat, kesengsaraan yang berterusan, takdir yang buruk, dan kegembiraan pihak musuh atas bala dan ujian yang menimpa. Bismillahirrahmanirrahim. La yadurru ma'a ismihi syai'un fil ardi wa la fis sama' wa huwa as-sami'ul 'alim. Dengan nama Allah yang tidak memudaratkan, dengan namanya oleh sesuatu pun di atas muka bumi dan di langit, dan Dia Maha mendengar lagi Maha mengetahui. Allahumma inna na'udzubika minal bawasi wal jununi wal judam wa min syarril asqam. Ya Allah, sesungguhnya kami berlindung daripada penyakit sofa, gila, kusta dan daripada segala jenis penyakit yang menakutkan. Na'udzubika limatillahi tammati min syarri ma khalaq. Kami berlindung dengan kalimat-kalimat Allah yang maha sempurna daripada segala kejahatan yang telah diciptakan. Rabbana atina fid dunya hasanah wa fil akhirati hasanah wa qina adzabannar. Sallallahu ala sayyidina Muhammad walhamdulillahi rabbil alamin.
Okay. And then this one especially yang patient basis lah, kena if a patient tu dah stop and ada lebih, ada extra PN bags atau lipid, please return immediately to pharmacy lah, because the one yang patient basis ni, especially yang kita dah add soluvite atau vitamin atau trace element ni, it's only stable for 7 days lah, macam tu. Okay. Okay. And then we move on to the next topic, Cytotoxic drug reconstitution or CDR lah. Okay, CDR ni is when we reconstitute cytotoxic drugs. Cytotoxic drugs ni yang used in management of cancer or malignant disease lah. And cytotoxic drug ni it is actually carcinogenic, teratogenic and mutagenic. That's why dia punya reconstitution tu ada dia punya special step dia lah, special precaution dia. Okay, so indication of chemotherapy, initiation. Actually, chemotherapy ni must be initiated by oncologist or gynecology oncologist, hematologist, respiratory physician with special interest in thoracic oncology lah, atau pediatric oncologist. Okay, yang masalahnya kat sini hematologist is Dr. Ismail lah, and oncologist yang ni yang biasanya di-refer lah Dr. Inani kan. Usually we will receive prescription from them lah and their MO. But so the responsibility of pharmacists in CDR ni is to ensure the availability, preparation, delivery and safety of drugs lah. And it is also our responsibility to reconstitute the cytotoxic drugs according to guidelines. And we have to monitor and manage pharmaceutical care issues lah of patient in the wards or the care. Okay, maybe cytotoxic drug ni semua orang tahu lah kot. Memang for cancer treatment. Okay, so okay here what I'm showing here is the chemo script lah. When doctor specialist nak start chemo regime dekat patient, they will send this chemo script to us, to PPU. Okay, which this one contains is like the protocol lah for the patient kan. Apa chemo drugs yang ada dalam regime tu and the dose. So the important one here is the height and weight lah. So we can calculate the BSA because most of the chemo drugs dia punya dosing according to BSA kan. And then when pharmacy receive this, we will screen dulu. Okay, and tengok dose ni betul ke tak, and the height, weight and BSA tu betul ke, is it updated. And then we also use we will also screen the infusion duration dengan diluent ni suitable or not, okay, because we need to look for the stability, the highest concentration that we can give to patient yang selamat kan, because as we know cytotoxic drug ni is hazardous kan, even it is used to treat patient. Okay, and chemo script ni we request for prescriber to send to us early because for regime yang atau protokol yang tak pernah lagi yang baru ataupun ada flex. For example, this one protocol for this specific patient ada perubahan sikit kan, ada like one component tak ada, one drug tambah ke, then we need to buat new template dalam air pesakit and that will take time lah. So chemo script ni biasa kita minta doktor hantar awal lah, at least 1 day before. Okay, and then we will also do label siap-siap untuk letak for our reconstitution punya ni lah purpose. Okay, this one is another form ada dalam air pesakit. It's called Cytotoxic Drug Reconstitution Request Form. This one usually kalau patient yang on chemotherapy, kita tak guna yang dia, kita guna Chemo Script tu. This form usually untuk yang kita guna cytotoxic drug for procedure. For example, mitomycin for intravesical, or mitomycin for LASIK, doxorubicin for test procedure ke, kan? Then we will ask doctor to fill in this form lah. Ni pun kita request kalau before this actually 2 days before, but now kalau 1 day before pun okay lah, sebab we need to tak dalam our schedule kan bila nak prepare semua nak record. Okay, and then this one is macam biasa how to prescribe chemotherapy dalam air pesakit lah. Sebab apa pergi dekat e-prescribing, kita akan nampak ada dekat tab atas ni, kalau ubat biasa kan new ERS kan, this one choose chemotherapy, and then ada chemotherapy prescription ni lah. Okay, so the chemotherapy regime ni yang pharmacy akan buat template dia, so the doctor can atau prescriber can choose from here lah the chemotherapy regime. Okay, and other information macam biasa kena make sure betul, the weight, height, PSA, okay, which cycle is this one. Okay, and then another one yang important is the dose here, kan, for each drugs, can make sure dose ni betul lah. Okay, mesti pharmacy pun akan screen balik and kira. And then lagi satu drug omission. If for example in this one protocol ada one drug yang nak omit, please click here lah, and then biasa akan keluar kolom kenapa nak omit kan, just fill in lah kenapa. Okay, yang bawah ni just result, lab result. Okay. And then after pharmacy dah terima yang Chemo Script distribution, we will prepare or recon the cytotoxic drug accordingly lah. So some of few reminder. Like I said before, dekat suspect ni kita ada hematologist dan oncologist yang ni lah yang kita boleh refer. So kalau ada doktor nak start chemotherapy for patient, please refer to the designated oncologist or clinical hematologist lah. Okay, and then please send the Chemo Script or CDR request form at least 1 day before. This one include or especially for mitomycin intravesical lah, sebab sometimes we receive like nak pakai petang tu, tiba-tiba petang tu juga baru cakap ke, or like pagi tu after tengah hari baru inform pada kami ke. Like, macam saya mention, kita ada jadual masuk clean room tu, and we need to stick to that one lah. Okay, nanti saya akan tunjuklah proses macam masuk clean room semua. And Chemo Script ni pun kita request minta send awal sebab kita nak prepare the chemo regime template in the air pesakit, semua nak prepare label. So it will greatly help us lah if we receive all the requests or Chemo Script early. Okay, sebab ya, kalau semua dah boleh siap awal, prepare awal, kita pun boleh record masuk klinik awal kan, boleh dapat ubat awal, boleh administer awal pada patient. Okay. And then sama bila dalam air pesakit pun kena prescribe the chemo regime by 11 AM. And then if ada patient yang cancel or there's any drug yang need to be omitted, please call pharmacist or PPU lah as soon as you can, sebab kita tak nak bila kita dah terbuat, dah terprepare lah baru inform, sebab ubat chemo ni pun sama, some of them ada short stability lah, ataupun some of them yang memang costly lah kan. Kita tak nak ada wastage, kita nak kurangkan wastage. Okay, lagi yang important juga is cytotoxic waste. Kita please make sure, especially in wards, kalau daycare diorang dah biasa, that's what they do every day kan. Kat ward we don't have a very macam one designated ward for chemotherapy kan, for chemo apa tu pun oncology patient kan. So kalau ward lain medical ke yang ada handle cytotoxic drugs ni, please make sure to describe the waste properly lah, because as we know chemoterapi atau cytotoxic ni dia hazardous. So tak boleh buang dekat sampah biasa ataupun in the clinical waste biasa lah. Make sure it is labelled properly, okay, cytotoxic waste, and then it's separated or segregated from other waste yang biasa lah ataupun clinical waste yang biasa. Yang itu penting lah. And then another one is cytotoxic spill, management of cytotoxic spill. So please make sure yang any ward yang kena handle cytotoxic drug ni, they have that cytotoxic spill kit. Kalau tak ada ke, ada barang tak ada ke apa, please request from us lah, from PPU. And then semua kena tak semestinya hafal, but mesti tahu kat mana nak cari how to manage the cytotoxic spill lah if ada. Yang sama waste daripada cytotoxic spill ni pun kena discard properly. Either the waste itself, the spill itself ke ataupun PPE yang kita pakai ke. Okay. Alright. Then we go to other sterile preparation, because actually it's other than PN, adult unit ke, and also CDR, we also prepare other sterile preparation lah. Contohnya macam eye drops ni banyaknya antibiotic, and also mitomycin for LASIK procedure. We also prepare when requested intravitreal. This one usually sama, antibiotic juga, intravesical, and also intraventricular lah if requested, and other IV admixtures. Okay, this is just want to show the list of eye drops or preparation yang kita buat lah di SASMED. Macam kita nampak dia punya stability eye drop ni pendek je lah, because we prepare ni bukan yang dia letak preservative ke apa kan. And for eye drop yang commonly used like ceftazidime, gentamicin, dua ni lah, fluconazole, PPU dah prepare siap-siap lah and bagi pada inpatient and outpatient. So bila doktor order, we can bagi terus lah. Tapi yang jarang-jarang guna macam vancomycin ke mitomycin ni, then you have to prescribe and inform pharmacy lah, sama ada inpatient, outpatient ataupun PPU directly. Okay, so lastly, actually I want to share a bit about sterile compounding, because actually aseptic in my title, aseptic services ni, aseptic as we know is something that is free of contamination kan, aseptic. Sterile pun dia maksud dia sama, sterile maksudnya free from pathogen lah ataupun contamination. So what we do every day in the clean room is sterile compounding lah. Sterile compounding ni, what is sterile compounding is it is preparing a medication in an environment free from bacteria, viruses or other potentially infectious microorganisms lah. Actually it's impossible to be 100% free, but we want to reduce or avoid as much as we can lah, sebab this TPN, CDR, IV admixture ataupun eye drop lain, we will the medication tu we will administer directly dalam intravenous kan, dalam vein parenteral, through parenteral kan. So kita kena tak boleh, ubat tu tak boleh contaminated lah, sebab akan bagi risk of infection pada patient. Macam tu. And then sterile compounding ni we do using aseptic technique. Aseptic again meaning that the technique that we use is the aim is to reduce contamination as much as possible. Maksudnya memang nak kurangkan ataupun zero contamination lah, ataupun zero bacteria semua kan. In the clean room. Clean room itself maknanya clean room ni is bilik yang we control the parameters, the temperature, the humidity and everything, even the design or structure to minimize contamination kan. So everything maksudnya semua kita nak prepare, the hasil dia is ubat yang free from contamination lah, free from pathogen. Okay. And dalam clean room, we use these three equipment lah sekarang actually. Laminar airflow, biosafety or isolator, which is also the aim or the purpose of this equipment is to reduce contamination lah. Okay, to the product that we prepare. But saya tunjuk gambar. This one yang ada dalam clean room kami. Laminar airflow ni we use to prepare non-cytotoxic preparation, sterile preparation lah macam TPN, eye drop semua. Okay, for biosafety and isolator, this both equipment kita pakai untuk cytotoxic drug reconstitution lah. Apa beza dia dengan yang ni? Yang these two selain daripada bagi atau protect the product from contamination, is also protect personnel from the hazardous drug itself lah. Maksudnya kita nak maintain sterility of the product, but at the same time kita nak maintain personnel daripada contaminated by the hazardous drug tu, daripada chemo cytotoxic drug tu. Okay. Okay, this one tiga ni. Just nak tunjuk je lah, kita prepare dalam clean room dan juga dalam equipment ni lah. And equipment ni semua sebelum kita pakai, kita kena clean dulu, guna sterile IPA 70% lah. And even before nak masukkan barang-barang item semua dalam ni, kita kena swap semua benda guna sterile IPA 70% lah. Maksudnya banyak step lah kita kena buat sebelum prepare, sebabnya tujuannya, the goal is to minimize contamination. Itu je, satu je. Okay. Next, I will show this, ada two video. Okay. This one is regarding our clean room lah. Kalau tak dengar suara, bagi tahu ya. Sekejap. Dengar kan suara video? Tak?
Kuatkan lagi.
Okay. Okay.
Yay!
Wah. Suara tak dengar
Tak jelas Aina, tapi boleh nampak lah.
Oh, so ada explanation sebenarnya. Macam mana nak buat? Kita kena guna player lain. Sekejap. Ni dengar tak? Ke sama je?
Sama je, tak dengar. Tapi rasanya Aina boleh apa tu? Boleh guide along the way kot.
Okay. Sekejap saya ingat je. Okay, this is our clean room lah. Sekejap besar sikit. Okay. Just there's actually explanation regarding our clean room lah. Clean room ni kita sorry ada grade A, B, C, D. The difference is berapa banyak microbe yang ataupun apa tu microorganism yang permitted in per cubic square lah. Kalau yang A tu dia paling bersih, which is usually our cabinet LAFC atau dan juga BSC isolator lah. Yang bilik lain ada grade B, grade C, grade D. D is yang kira paling kurang clean lah. Okay, we monitor the humidity, the temperature, and we also do microbe test every 2 months lah. Sebab kita kena control kan, tak boleh bilik tu banyak sangat. Microbe count dia tu kan, nanti kira tak ni lah. And when entering clean room, ada step-step yang kita kena ikut lah. First 7-step washing, then kita kena pakai proper PPE, gowning, mask semua kan. And this one is when we are preparing PN lah. This is our lamina airflow cabinet. Grade A lah dalam ni, we maintain. This one is the preparation of adult PN. Tak dengar apa ni. This one ni untuk cytotoxic drug lah. Dia lagi banyak PPE yang kena pakai to protect the personnel. This one the preparation or reconstitution of cytotoxic drug lah. This is the PPE that our staff kena pakai before we enter grade B untuk prepare PN lah. Jumpsuit. Bila. Okay. So ada lagi satu. Saya ni pun this one might tunjuk lebih detail sikit lah macam mana kita orang masuk to prepare this one TPN. Okay. So masuk clean room dulu. This one grade D lah bila kita nak masuk grade D. Okay, governing semua. Okay, macam saya cakap nak masuk clean room tu kita kena swap everything dengan IPA lah. Okay. Memang ada 2-3 kali lah kena swap. Okay. So ada apa tu pakai PPE untuk masuk dalam grade B. Okay, saya cakap tadi sebelum kita guna kita kena bersihkan dulu. Actually after dah siap preparation pun kena bersihkan guna sterile IPA 70% jugalah. So apa yang saya mention kena guna aseptic technique when preparing this TPN, CDR semua lah sterile preparation. Okay. Sorry. Okay, so from the videos that I showed just now, kita boleh tengoklah step untuk masuk clean room and prepare the steroid compounding is not easy, not simple lah. Kita banyak kena apa tu PPE yang kita kena pakai and also the step itself kita nak swap, nak pastikan barang-barang yang masuk dalam clean room tu bersih and apa yang kita prepare tu pun tak ada contamination kan. Okay, and then saya tulis kat sini cost of PPE memang saya saja dah tulis sebab nak tunjuk kenapa kita sehari kita orang buat jadual like in one day kita masuk sekali je, or macam mana kita kena buat or susun ni biar effective, cost effective lah kan. Lagi satu yang saya tunjuk tadi yang the second video is the preparation of adult PN. Actually adult PN yang paling is the simplest compounding lah. Kalau untuk neonate tu dia lagi complicated because we need to add in one by one the component. The component. So that's why it will take longer time lah. So saya harap dengan saya tunjuk video and the explanation, anyone yang tak pernah tahu how cell compounding ni ataupun macam mana TPN sedia ni are being prepared, boleh tahulah sedikit our workflow semua kan. Okay, and also why we have our schedule and why we want to stick with that lah. It's all about efficiency, cost effectiveness semua. But at the same time kita nak cuba serve yang terbaik lah untuk patient. Okay, this picture. That's all. Thank you. Any question? Ni extension kami lah. Saya, pharmacist Syauki Farhan dan juga unit kami lah, PPU. If ada, lepas ni ada any question ataupun nak berurusan dengan kami, boleh call extension. Okay. Itu saja kot daripada saya. Ada soalan ke? Harapnya apa tu? Dapat sedikit bagi update and exposure lah tentang PPU on aseptic services yang kami provide.
Alright, terima kasih. Thank you so much to Sister Aina for our sharing session today. And as of now, there's no question in our chat room, even in YouTube Live. So I guess don't forget to fill up the feedback form to get the CTD points. And for doctors, you guys can claim manually in my CPD for the session today for 1 point. Okay, without further ado, we postpone our today's session with Tasbih Kifarah and Instructions. Alright, thank you everyone. Assalamualaikum.